So usually we have our public officials at the end of the action, but to accommodate Commissioner Maggie Hart Stebbins and some family obligations, we're going to go ahead and do her first. Maggie, if you can go ahead and come up. So I am going to ask her a question, and then she'll have 2 minutes to respond to that question and the reactions of today. So Commissioner Maggie Hart Stebbins, will you meet with Albuquerque Interfaith before the end of the year to evaluate the progress and governance of the county's 1.8-cent sales tax so far and identify the steps necessary to create a comprehensive mental and behavioral health care system in the Bernalillo County? Yes or no?
Yes.
Okay. So Sister Agnes has the time. She'll keep you on track.
All
you
right.
have 2 minutes.
Thank you. And I first want to say thank you. I know this is rare that you would give me the opportunity to go first. Sunday is the day I spend with my parents. And so as you probably have older parents, these days become more and more valuable to me. So I mean no disrespect, but that is a priority for me. So behavioral health. You know, as I have been engaged in this issue, I have been really privileged to hear from people throughout this community their stories. People have been willing to share with me their experiences of their family members, their loved ones, who live with mental illness, who struggle with substance use disorders. And I feel really privileged that people are willing to reach out, share those very painful, heartbreaking stories with us. And those have shaped my ideas about what we do at the behavioral health tax. And really core among that, or really fundamental to that, is that this continue to be a community conversation, that this is not something that 5 commissioners make decisions, but that we do have continuing input from the community, from people who are on the ground, people who know what it's like to live that experience. I think, as Kip has mentioned, we have now appropriated about $8 million that have been really focused on priorities that have been identified for years, for decades sometimes. Is it a comprehensive system? Not yet, but we make a commitment. I think the commission certainly has a commitment to getting there. We need willing partners. We need the other stakeholders in this community, University Hospital, the City of Albuquerque, Presbyterian, all the providers and stakeholders to work with us. And that is where we can use your help. You know, don't just focus on the county commission. We are a huge part, but we're not the only part. So I really want to reach out, ask you again to continue your engagement with us, but also with the other organizations and individuals who have a role. Hold them accountable as well. Thank you.
Earlier that we are about building power to act together and build constituencies. We know that our power alone is not enough. We need the power of elected officials and allies to work with us. We will now be asking questions with commitments being made from each official in regards to their roles in continuing to build on a comprehensive mental and behavioral health system. Albuquerque Interfaith leaders have met with each official before today, and they have received the questions ahead of time. Each public official will have 2 minutes after the questions are asked and then answered. They will elaborate on their answer and give the reaction to what they have heard here today. Officials, we ask that you initially respond with a yes or no to the question, and then your 2-minute response time will begin. Sister Agnes here is sitting here with the time cards, and she will keep you posted on time.
For the first question, we'll ask all of the public officials to come up and stand at the mic at the same time, if you would. And the first question...
Flanked by 2 good-looking guys.
The first question is, public officials, will you work with Albuquerque Interfaith to develop a plan for a comprehensive behavioral and mental health care system in Bernalillo County? Yes or no?
Yes.
Congresswoman?
Oh,
Yes.
your turn.
Yes.
All right.
Yes, you first.
Now, if the 2 gentlemen would take a seat, Congresswoman is the first to be questioned.
So Congresswoman Michelle Lujan Grisham, I'm going to ask you the first two questions. Will you meet with Albuquerque Interfaith before the state legislature convenes to help us understand and engage in how Medicaid decisions at the federal and state level affect our mental and behavioral health care system? Yes or no?
Yes. We're going to have to get Paul Ryan to let me out, but yes.
Will you work with us to seek out funding sources for programs to fill the gaps in the system? Yes or no?
Yes.
Thank you, Congresswoman. Your 2 minutes start now.
Thank you. Thanks to everyone who's here on a beautiful Albuquerque Sunday. It's beautiful. I was out with my mom earlier, and then I'm going to go right back. But this is an important issue that affects all of our families. It definitely affects my family and my mom. I was both delighted, interestingly enough, by the honesty and earnesty of Dr. Wagner, and really upset about it. It is a generation. We have completely eroded our behavioral health system. And from the moment that I was, and thank you, elected to Congress, oh, thank you. Thank you. I have been fighting, and I've gotten great support, including from Representative Steve Pierce, to call for federal investigations, to require the state to refund all of those providers, to be accountable, to change their data, to be transparent, to meet with providers, to meet with constituents, to meet with the behavioral health community. There have been phone calls, letters, meetings at the White House, meetings with the Chief of Staff, meetings with CMS, meetings with HHS, and in none of them were we very nice. Because it is the federal administration allowed the state to take the action that it did, and then has refused to hold this state accountable in terms of looking at whether or not there's Medicaid parity. So what your state has been saying is there is, and there is not. So in terms of funding and stopping this, this is what we already have. One, Medicaid Integrity Act introduced. It'll get reintroduced next year. It says no state could use the Affordable Care Act to do this ever again. Two, Behavioral Health Infrastructure Act, which would give states a 90% match on investing, because we're going to need it, in a behavioral health infrastructure, housing, hospitals, care providers, outpatient systems, transient systems, workforce investments, all of it, and $30 million to give states grants. And I know my time is up, so how about two more? We've already done $4 million to police for crisis intervention training across the country. We'll do more. And how about a 1 cent
Congresswoman,
tax?
thank you very much.
No way. One more.
I'm being...
A 1 cent tax on every opioid prescribed to the manufacturers that comes right back to states for grants. Done.
District Attorney-elect Raul Torres. We have two questions for you. First, will you work with Albuquerque Interfaith to identify the gaps and deficiencies in the current system contributing to the criminalization of mental illness and addiction in Bernalillo County?
Yes.
And as you know from when we met with you earlier, we are interested in building relationships with allies who share our vision. Will you facilitate conversations of Albuquerque Interfaith leaders with specific leaders from the business sector who share a commitment to treating mental illness and addiction as health care, not criminal justice issues?
Absolutely.
And you now have 2 minutes to expand your answer.
So I got to tell you, I'm a little terrified on the fact that Sister Agnes is manning the clock. As a graduate of St. Mary's Elementary School, I'm having sort of flashbacks. But what I will tell you is that, you know, over the last several days, I've been thinking about something that I was actually taught at St. Mary's. And I didn't understand it then, and it was a concept of grace. And I don't think I understand it fully now, and I'm certainly looking for it. But I think it starts with the recognition of a very basic principle, and that principle is simply this: I am my brother's keeper. I am my brother's keeper. And I know this is off topic, but I want to say something. To my Muslim brothers and sisters here today, we are with you. And for members of the immigrant community, we are with you. And I can promise you that as the district attorney, we will not tolerate acts of violence, intimidation towards anyone in this community, ever. We, each and every one of us, have to be a light in the darkness. We have to recognize that we're not going to incarcerate our way into being a safer community. We incarcerate more people than any other country on the planet. 25% of the world's inmates are in this country. We spend $90 billion a year, and we are not making this community safer and this country safer by doing that. We have to come up with a different way, with a new way. And I will close by saying that I believe in the idea that the arc of the moral universe bends towards justice. And it just got a little longer this week, but with the work of the people in this room, we can still get there. Thank you very much.
State Auditor Tim Keller, will you commit to a continuing transparency report for the county's 1/8-cent tax for mental and behavioral health to make sure that it is spent on new and expanded programs and governed appropriately? Yes. Will you commit to completing a transparency report of the spending from the city's 1/4 cent sales tax for public safety to determine how much was spent on new and expanded programs?
Yes.
Your 2 minutes begins.
Thank you. Well, let me just begin by saying I know for many of us it's been really an unfathomable week in terms of what we've had to deal with. And I want to speak directly to the issue, but I also want to say I was proud of New Mexico. That's right. By and large, we were one of the few people in the country. We rejected racism. We rejected sexism. We stood up for the community values that we've always had here in New Mexico, and I was very, very proud of that. Now, what are we going to do about behavioral health? I want to tell you this. Two things that were mentioned before that I want to bring together and hopefully help with. One is, I was in the state Senate representing the International District, and I worked with many of you here so hard on all the issues, fighting back against that driver's license bill, supporting pro-immigrant legislation. But at the end of the day, what the governor did with behavioral health, that also disproportionately affected people of color and people of low income all across New Mexico. That, to me, is an example of the kind of structural policies that are actually designed to hurt a certain type of person. And that's wrong. And I think it's important that we say that. This is more than just a healthcare policy. This is, in many ways, about civil rights and about social justice. So let's remember that side of the argument. Now, what happens a lot of times when we pass a tax, and the good thing is, as a county, and I know our commissioner left, but our county stood up, and they said, we're going to fill the void, and we're going to tax ourselves to support our own program, to replace the dismantled state program. That's a great thing. But what we see all too often as state auditor is we see politicians, we see executives, take the money that you gave us for behavioral health, and we give it to something else that we want to use it for. Right? And that's what's happened with this 4% tax that we did 10 years ago. So this is our chance, though. We can prevent it right here, and that's why I'm absolutely willing to step up and make sure they might be able to do whatever they want, and I might not have power to stop them, but you're going to know exactly what they're doing because I'm going to shine a light on it. Thank you very much.